Good morning, everyone. Respected dignitaries on the dais, members of the dental fraternity, all the guests who are attending the 11th IPS Karnataka State Conference being hosted by Bapuji Dental College and College of Dental Science, all the participants of the state conference, distinguished guests. Personally, it's a moment of pride and privilege for me to attend this conference because I am an alumni, because I have many things to say. Firstly, being the alumni of Bapuji Dental College. Secondly, being the governing council member of Bapuji Educational Association. And thirdly, a woman parliamentarian who is also a dentist and a member of the committee on health and family welfare, wherein as a member of the dental fraternity, I can propose the concerns of our faculty and the varied branches in dentistry. And congratulations to the organizers, both Bapuji Dental College and College of Dental Science, for putting up such a wonderful event with the meticulous planning right from the beginning, the cultural event. See, we do conduct many events across, this I would like to tell to all the guests who are attending the event. We do conduct various programs in all our institutions. Under BA, we have around 35 institutions, and every time I praise the dental college events. See, they might say I'm partial towards the dental college, but that is how the discipline and the meticulous planning is in the dental institutions. So congratulations to you once again. Okay, now since its inception in 1973, IPS has played a pivotal role in advancing clinical excellence, education, and innovation in prosthodontics across India. The Karnataka State branch, established in 2003, has carried this legacy forward with remarkable dedication in organizing academic programs, workshops, and public health initiatives like the Danta Bhagya Yojana, and its repeated recognition as a best branch 4 times in a row. So congratulations for that. And see, when you were explaining about the works being done by IPS, I think Dr. Umesh Pai, you did explain. The only thing missing was work related to research. So I think you have to work on research as well. And today, I would like to share my views on challenges, dental public health, and a path forward for India's oral health ecosystem. Now, we are all aware that India carries an enormous burden of preventable oral diseases. Over 85% of adults and nearly 80% of children suffer from dental caries or gum disease. But what is more alarming is that access to quality dental care is still a luxury in many parts of our country. The rural-urban divide is not just geographic, it is deeply economic and systemic. Yet, oral health is central to a person's dignity, their confidence, their ability to speak, to eat, of course, to work. It deserves to be a core part of our national health agenda, not a footnote, which I frequently come across during my committee meetings as well. Let me outline a few major gaps observed both in clinics and in policy corridors. Firstly, oral health has no dedicated institutional identity. It is still fragmented within general health programs. Secondly, research output is alarmingly low. India produces the largest number of dental graduates but contributes only 1 to 2% to global dental research. I think Dr. Shilpa and me were discussing that as well. Now, as a student and even as a mother, when I interact with my children in science subjects, what do we study about dental health? It's mainly the tooth anatomy. And then regarding our eating habits, how it will lead to caries, and then maybe the milk dentition and permanent dentition, and it ends there. So we need to encourage more knowledge about dental health, particularly the brushing techniques, which if we inculcate during the growing years, it will lead to discipline, and the right brushing technique can be inculcated in the young generation. And definitely about the increasing burden of lifestyle diseases, especially oral cancer. So more awareness at maybe the high school and college level could be brought in, integrated in our curriculum as well. And then regarding the SS Care Trust initiatives, in 2019, we started with SS Care Trust. Dr. Shamnu Shivshankarappaji is the managing trustee. Shri SS Mallikarjun is also a trustee, and I'm the life trustee in this NGO. We are running since 2019, and we have conducted many health initiatives since 2019. Mainly, it was Appaji and Mallikarjun's vision to give free dialysis services to the people in and around Davangere, especially the BPL card holders. And every month, we are conducting around 600 free cycles, which comes up to 15 lakhs per month. So along with that, we do conduct many health initiatives, and I would also like to add regarding the oral cancer awareness, which we have been conducting in and around Davangere. And especially in the government schools, we have reached around 65 government schools and educated nearly 5,000 children. And with over 170 schools in Davangere, we are still moving to cover. Our goal is to reach 100% coverage. Now, Dr. Shilpa, I would like to mention the support which both the colleges, the principal, and the Department of Community Dentistry, the way they are conducting is, it's 100% saturation at each and every dental college. So suppose we visit a particular government school, and if there are around 300 children in that school, and if on a particular day of screening, if they can screen only 200, they will revisit the school and see that all 300 of them are screened, and we receive 100% saturation. So that is how the faculty and all the people involved in this initiative, the Mughal Nage program, are supporting us. And we're also conducting numerous programs on tobacco, the ill effects of tobacco, chewing among the youngsters. And I would like to recall my personal experience as well. The first time I was introduced to something called a dentist or dental service was during my high school. I stay very close by in a village called Kakkargulla, which is around 15 kilometers from Davangere. So, as usual, it was my summer vacation, and I had a loose tooth, and which I complained to my Dodappa, my dad's elder brother. And then there was a dental camp from one of our dental colleges, which was happening, and he took me there, and my tooth, the milk tooth, was extracted. So that was my first introduction and exposure to dental services. So why I'm narrating this incident is, even in remote areas, if we have more mobile services, I think we can reach out to the last person. So we have to see that the dental colleges or private institutions, both public and private institutions, mandatory, they should have mobile dental vans, and serve even the last person in the village. And especially, we have to encourage our ASHA workers and Anganwadi workers. They are the bridge between the community and health infrastructure, right? So if we train these ASHA workers and Anganwadi workers about dental health and oral hygiene, Anganwadi workers mainly work with children between the age of 3 to 6 years, and they also associate with pregnant women, lactating mothers. So we can inculcate healthy habits among these age groups if we train the Anganwadi workers properly. Same thing with ASHA workers. Now we can educate the ASHA workers about dental health issues, oral hygiene practices, even oral cancer, wherein they have a responsibility of outreaching 1,000 people in the public. Each ASHA worker is connected to 1,000 persons. So directly we can connect with them and see that if at all any health issues, oral or dental issues arise, they can communicate and bring them to the respective hospitals in the locality, and better services and early services could be given, and even education to the public can also be done in a more systemic and organized way. Now, as a member of the Parliamentary Committee on Health and Family Welfare, I've personally, during my meetings, advocated for increased funding for dental and medical research through ICMR and DST, greater safety and support for the dental community in terms of finance as well, and integration of oral health into Ayushman Bharat and other universal coverage schemes, support for indigenous innovation in dental technologies and materials as well. But the time has come for a more structured and more ambitious solution. Let us propose the establishment of a national oral health mission similar to the lines of National Health Mission, and we also have a dedicated National Ayush Mission as well. See, even our Ayurveda, Unani, Siddha medicines already have a dedicated structure in the health ministry, but we dentists do not have a separate representation. So I would like to share my official email address, and everyone, today we have the IPS event happening, so you will be coming across the Indian Dental Association chairperson, the secretary, so please interact in your faculty also, and if you could update me with the concerns of your faculty, I would definitely be, I wouldn't say your voice, our voice in the ministry, in the committee as well. And so this mission of National Oral Health Mission will focus on governance, a national directorate with state-level officers to drive planning and delivery, infrastructure, dental units in every PHC and health and wellness center, with tele-dentistry and mobile vans reaching remote communities, research and innovation, a dedicated national research fund, and support for industry, academia partnerships. This we really have to work. We have to partner across, within our fraternity, within other allied sciences as well, and even allied medicine as well, for us to perform much better in innovation and research. Monitoring and accountability, a robust data system integrated with National Health Mission dashboards and Niti Aayog indicators, which is a think tank of our government, wherein we can get real-time data on dental and oral health in our country. And the mission would be centrally sponsored, co-funded by states, and supported by professional bodies, in your case like IPS, and maybe we should think about collaborations across NGOs, maybe CSR initiatives, more from private companies, and also among more initiatives from your fraternity as well, the ones who are doing really well, the alumni as well, giving back to your institution and the rural areas around your institution. That will be really helpful, maybe sponsoring a mobile van as well. And the role of IPS and the dental fraternity. Now, to make this vision a reality, I urge the IPS and dental fraternity to step forward, be advocates, not just for your patients, but for the profession itself. Mentor the next generation of dental researchers. I think this, we need to do it within our undergraduate program as well. And lead public health efforts like Danta Bhagya with more energy, maybe saturating it 100%. If we educate the ASHA and Anganwadi workers, they will definitely see to that when the tooth loss happens, before we lose out on the bone, the mandible, resorption happens, we have to intervene and educate them properly, the right time when a denture has to be placed in the patient's mouth, and then partner with government in pilot projects for new technologies in rural care. So you're not just clinicians, you are the change makers. And in my conclusion, let me end by saying this. We are in a defining moment, a moment wherein science, service, and policy can align to create a healthier, more equitable India without the rural and urban divide, equal opportunity for all. Let us ensure that oral health is not a forgotten corner of healthcare, which I really experience in my interactions. Let us build a nation where every smile is protected, every dentist is empowered, and every citizen has access to care, not as a privilege, but as a right. Together, we can make one nation, one smile a reality. Thank you. Jai Hind, Jai Karnataka.
We thank you, ma'am, for sharing your wonderful experiences with us. It truly is an honor to have you here amongst us today.
Now, I would like to request the President, IPS, Dr. Shilpa Shetty ma'am to